Hello, this is Mark L. White with Health Hacks, and today I'm proud to have my friend Dr. Sage Wheeler with us. Dr. Sage Wheeler is the head practitioner, owner of Sage Med out in Washington State, near Seattle, Bellevue.
Yeah. Hi, Mark. How you doing today?
Good. I'm doing wonderful. And I love talking to like our West Coast practitioners, because you guys are like always on like the latest stuff. And I don't know if it's that you're near like Eastern medicine, but you guys are like the bridge between Eastern medicine and Western medicine. And when I look at what you're doing, you're right there.
Yeah, thank you. We're an integrative medical center, so we do our best to try to integrate the best of modern diagnostics, modern equipment, but we also kind of respect the laws of natural healing. The body kind of has a tendency to want to do its own thing, and it strives towards wellness, and we just try to remove those obstacles in the least harmful way possible. So we don't really consider it necessarily east, west, or alternative or anything like that. I just frankly think that medicine is medicine. It's just good medicine. And no matter what the origin, if it makes sense, if it's rational, if it's effective, and if it's safe, that's something that I'm going to use. It's like Gainswave. That's kind of your guys' group has introduced me into shockwave therapy. And that's a low force intervention that's very safe, very effective. And so that was obviously a really great fit for our practice. And honestly, since then, getting into the sexual wellness industry has just been such a good time. If I would have known the way to get guys to come see me for primary care would just be advertise erectile function, services, that would have been a game changer for me, because that's what gets guys to come in, when they can't get an erection anymore. And they come in and we do a big comprehensive screening, and we find multiple nutrient deficiencies, hormone deficiencies, cardiovascular disease, prediabetes, and we're able to address that in kind of a functional, holistic way. It's just been really fun, and I've never seen so many guys in my clinic before, which is also great.
So how did you get into, you're a naturopath, you're not like a traditional MD or DO?
Yes, I'm a naturopathic doctor. In state of Washington, we're licensed as primary care physicians. In about a little bit less than half the states, that's how we're licensed. And in other states, we're not licensed to practice at all. And so we're definitely kind of a fledgling group compared to MDs and DOs. I have always been interested in all kinds of medicine. I was studying to be an MD, particularly I wanted to do orthopedic medicine. And just during my training of that, I got really turned off by, the slice and dice attitude of a lot of the doctors. And I wanted to get into regenerative medicine and start treating things before they became these big surgical problems. And so I found Bastyr University, and I really liked that their approach to medicine. And after graduating, I did a residency. It was called the ITI STAIR residency. It's an integrative residency. So half my time was spent with board certified family practice residency. The other half was with naturopathic family practice. And we practiced all together in one clinic. And I got to kind of see the different approaches of the medical doctor, the naturopathic doctor. And I got to kind of pick and choose what I liked best about their approach. And that kind of was what got me into integrative and functional medicine.
It's interesting because there was an article talking about the future of medicine. I think it was put out by Deloitte and Touche. And they said that currently 95% of all healthcare spending is on reactive stuff. You're already injured, you're sick. But they said that in 20 years, 60% of the spend is going to be on proactive, interventional, integrative medicine. And when you think about it, why isn't this more like that? Like, we treat our cars better than we treat our bodies.
Yeah, that's so true. Well, it's funny. I actually have an answer for you because I actually happened to have a regional manager of one of the largest insurance companies out there, part of the Blue Cross Blue Shield plans. And I asked him that question. I said, hey, why don't you guys pay for more preventive care? Why don't you push it more? It seems like almost like you're trying to stop it. For example, I do an injection called visco supplementation. It's a hyaluronic acid injection into the joints. It's FDA approved medication. It's just like, it's like a Jiffy Lube for your knees, you know?
It sounds amazing.
And it's fantastic. And it's not super expensive. I think it's $200-300. And if you do it often enough, you know, just like oiling a rusty hinge, you're gonna prevent breakdown of the material. And so patients were thriving on this, and then all of a sudden, insurance companies won't pay for it anymore. And they're like, just take painkillers until you need a total knee replacement surgery. And so I picked that example and I said, why do you guys do stuff like that? You know, knee replacement's a big deal. It's a 0.3% mortality rate during these surgeries. You know, people are having severe complications and dying. It's rare, but it happens. So why not pay for little, you know, a couple $100 here and there and keep those knees well lubricated and prevent the breakdown of the knee? And he said, look, the average policyholder is with us for 3 years. Our job is to kick the can down the road for 3 years. And we keep doing that. Every commercial insurance company keeps doing that until they're on Medicare, and then they don't care, right? Because Medicare is going to foot the bill. And then everyone's losing their minds like, oh, Medicare's insolvent. Like, well, that's why Medicare struggles financially. They don't get to get the money from the healthy young people who aren't really utilizing healthcare. And all these commercial insurers are just kicking the can down the road until Medicare foots the bill. And so that's why there's no focus on prevention. It's literally just kicking the can down the road till Medicare foots the bill. If we changed it so they were the insurance company for that, the rest of that person's life, like no more Medicare, you have to stick with your plan indefinitely. They would be all over preventive care, or the other way around. If it was just Medicare from day one, and we just all bought into Medicare, then also the huge emphasis on prevention. But the way we have it split now, we have for-profit enterprises running healthcare for healthy individuals from age, you know, whatever, 18 to 65. And then as soon as they hit 65, that's when most people need more expensive care, and they're going off to another system that is, you know, different and subsidized by the government, and of course all of our tax money. So that's a kind of long answer to your question, but it ultimately just comes down to finances, and
it's all about the money.
It's all about the money. And it's not like I don't like making money, you know, I love making money. And I charge a lot for my services that are not covered by insurance because we are on the cutting edge. But institutionally, I think that we're not really set up for a preventive care model because of that two-system model that we have. It's pretty unique to America.
Yeah, I think like in Eastern medicine, the whole emphasis is on how do I keep you healthy so you don't get sick, and then I'm doing my job as a practitioner. Where in Western medicine, it's if you're healthy, why are you seeing me?
Yeah, it's kind of, you get that vibe like, you're fine, let's just get out of here. I'm busy with sick people. In traditional medicine, and I believe it was China, I took a class in traditional, at the time it was called traditional Oriental medicine. I think they prefer traditional East Asian medicine now. The instructor said that the way they typically get paid was they have patrons that pay them to keep them well. And when they are sick, they no longer receive payment. They don't get paid until they're well.
Yeah, you're not doing your job. I've heard that too, and I think that's a great. Even if it's a little bit of an exaggeration, I think it kind of shows you like doctors should be keeping us healthy, and that's what I respect about the whole naturopath. Because you don't really see naturopaths on the East Coast. It's more of a West Coast phenomenon. But naturopaths are into healing, into this integrative wellness, and that will be the future of medicine.
Yeah, I really hope so. You know, our dream when I came into naturopathic medicine was we wanted to take over the world. We want everyone to kind of see our point of view, to integrate the best of all disciplines of medicine, to be preventive, to trust the healing power of nature, to do no harm, to focus on wellness, to be holistic. And unfortunately, how it's turned out is we really see the medical doctors and the DOs, they're getting more and more into, these modules from the Institute of Functional Medicine. It's really kind of teaching them how to practice more naturopathically. And we're seeing it more accepted in the mainstream medical community, and we see them becoming more holistic. And, even though we'd love for them to all become naturopathic doctors and, and our profession would get more support and recognition, it's kind of delightful to see that happening as well. I went to one of the first Institute of Functional Medicine symposiums. What is this all about? I want to check this out. And I was bored out of my mind. It was like going back to naturopathic medical school. It was all stuff we'd heard 1,000 times before. But it was great to see these, some doctors have been practicing 20, 30 years. These are very experienced medical doctors. Their minds are absolutely blown, Like, I remember the conversation we were having about probiotics and how it can affect your mental health, and absolutely blowing their minds that your gut flora can impact your mental health. It was really nice to see that awakening in them. And I see that happening at a very rapid pace. We've got Mark Hyman and other MDs kind of leading the way for their crew to be more functional, be more holistic. And so I don't know if it's necessarily going to be naturopathic doctors, but I think functional and holistic medicine is making its way into all healthcare professions.
What do you think is driving that? Is it more the consumer is demanding it, or do you think doctors are having like this aha moment?
I think that consumers really are demanding it. I'm writing a presentation right now for one of the conferences I speak at. It's basically about understanding men and men's perspective on healthcare. And why don't men go to the doctor? So I read a lot about formal studies on this. And it's kind of predictable, the type of men who don't go to the doctor. They tend to be younger, tend to be heterosexual, tend to be single, and more conservative. And basically, those are the toughest ones to get to go to the doctor. And they just don't find value in it, is what most guys said. It's like, well, I spend 45 minutes waiting, and then I go to the room, I'm expecting to see the doctor, I spend another 45 minutes waiting in there. So I've been sitting around for an hour and a half. This rushed doctor comes in, spends 10 minutes with me, and he gives me a Band-Aid, or he gives me a pill. He doesn't address the underlying cause of the problem. And I think patients intuitively know that I don't have a Prozac deficiency. Why am I depressed? Where they come to, a naturopathic doctor or anyone who practices functional or holistic medicine, and we're going to sit with them for an hour, and we're going to talk about their lifestyle. We're going to talk about their relationships. We're going to talk about spirituality, and we're going to do nutritional assessments. I'm going to find this person, and I see this all the time. They're maybe on Prozac with maybe Abilify, and they're still not doing well. And they're vitamin B deficient. They have high homocysteine, which is the best indicator of your B status. They're vitamin D deficient because they live in the Pacific Northwest up here. We don't get any sun. They're omega deficient because they don't eat enough, cold water fish and fatty foods, nuts and seeds. And that's an important brain nutrient. If they're older guys, they're usually testosterone deficient. And so in my clinic, it's kind of an ongoing joke because my job has become relatively easy once I figured this out. We call it the big 3 and T. It's those 3 nutrients: vitamin D, omegas, and Bs. Usually it's folate and B12, and plus testosterone. If you do that, 90% of the people coming in with various chronic illness, they're going to get better. They're not going to need those pharmaceuticals.
If you're talking about guys in their 30s and 40s, you're not talking about like 60 and 70-year-olds.
Oh yeah, those guys too. Yeah, absolutely.
What do you think is the future? Because when you look at what you're doing too, it's a lot of it is plant-based. It's not like you were mentioning Prozac, right? And I was talking to a practitioner actually yesterday who believes that the biggest thing is that we're going to be using plant-based medicine, like psilocybin, psychedelics, for treating a lot of mental issues. And I know on the West Coast, you guys are probably on the forefront of that. Do you think that's going to be a game changer?
Oh, absolutely. It's decriminalized here in Seattle, so patients can grow their own and try their own if they want to. It's difficult for us as healthcare professionals because it's not federally legal. We can't prescribe those things, but I do see that they're finally opening up to some research, and because it's a Schedule 1, we couldn't even do research on it. But now we're getting exceptions. Internationally, there's more research, and we are seeing that a broad range of psychedelics are helping to rewire the brain. They basically make it more plastic to help move those neural connections around, get out of your rut, so to speak, neurologically. I do think that is going to be the future. At my clinic, we have our sexual health program. That's a big one. The next biggest one is our integrative psych program we do at SageMed, where we take people through, the big 3 and T. We look for nutrient assessments, hormones. We do transcranial magnetic stimulation, TMS for short, which is phenomenal.
This episode is brought to you by Gainswave. If you're a guy who is not achieving optimal performance in the bedroom, and you've tried the pills and you've tried the shots, and you're looking for an all-natural way to boost blood flow in the penis, Gainswave is evidence-based and proven. Go to gainswave.com and find a provider near you.
Modality for making the brain a little bit more plastic and helping to reset those ruts that people are stuck in. When patients have combined that with psychedelics on their own volition, we've seen some phenomenal results. And so it is, again, an integrative approach. You have to set that foundation: vitamins, nutrients, hormones, and then you need to induce plasticity somehow, whether it's TMS, whether psychedelics, or both. Then we see some great results. And ketamine kind of falls in the middle somewhat. It's not really a psychedelic, but it does tend to make the brain a little bit more plastic.
You can prescribe the ketamine because it's not Schedule 1.
Yeah, ketamine you can get through compounding pharmacies. There's S-ketamine, which is the FDA-approved nasal spray. And so a lot of options for treatment-resistant depression. That's definitely going to take over, I think, from the SSRI model and SNRI model of medicine, which recently there was a big study that was really questioned if SSRIs are even effective at all, other than a big anecdotal, group of doctors that just says, well, I've seen it work. We're not really being scientific when we say that, because when compared to placebo.
I was going to say like 50%, the placebo, you're hitting 50%. So what is effectiveness?
The placebo numbers in those studies are incredibly high. So it kind of makes you wonder.
It's almost that with mindfulness or meditation, and do you do that with your integrative psychology program? Do you also talk about the importance of meditation and incorporate that in the TMS?
Yeah, we typically have our counselors do that, where we focus a lot on mindfulness. So it's a blend between cognitive behavioral therapy and mindfulness that we emphasize. So our counselors are great. And the wait list to get in is unfortunately months long. After the pandemic, there's a big need for mental health support.
Yeah, I think that's also something where, the traditional healthcare is catching up to the cutting edge integrative stuff.
Oh, absolutely. We're seeing way less lag time between a discovery like mushrooms being helpful for depression, for PTSD, and typically we're looking at like a 5 to 15 year time to do more research, develop standardized drugs, get FDA approval, and we've just really seen that accelerated a lot, and particularly the research into psychedelics. I know there's some big money behind that. I think Peter Attai, that's how you say it. billionaires. There's some billionaires that are interested in psychedelics, and that's going to really drive things pretty hard.
But it's funny, we're getting back to the whole thing is like once money gets involved, things just happen somehow.
Yeah, unfortunately, the world kind of revolves around the money that we put into things, and that's where we show our value, right? I wish I could get people to realize that they're sometimes trading their health, for money, and then when they get towards the end of their life, they start trading their money for health. And
You take like money, if you don't use it, you lose it. Like, whereas if you can convert it to like a better, healthier lifestyle, like it's such an amazing investment.
yeah,
Unfortunately, I don't think a lot of people look at it that way. They wait till they get really sick.
they do.
And they try to get their insurance to pay for substandard care, unfortunately.
Yeah, and they're not going to have any luck. With the sexual health services, we do use a lot of cutting edge devices. It is expensive. I use the Alma Duo, which is a focused shockwave device. They're a lot more expensive than the radial, but my experience has been good with those. That device is a six-figure machine. I use the M-Site PRP system to do my P shots. That's the top of the line, and you can concentrate that PRP as much as you want. It's expensive, so my guys are paying $5,000-$6,000 for their treatments until they get better, because they're so far off. They've got prediabetes, they got obesity, they got low testosterone, they got nutrient deficiencies, and when I occasionally get those guys who come in, have taken really good care of themselves, and just age has got up with them a little bit, and they have just minor blood flow issues. They just get a couple shockwave treatments, and it's way less expensive, and they get good results. They bounce back really quickly. And so the difference between those who have really put in the preventive care and their response to the sexual health services is incredible. They're minimal amount of money out of pocket, and they do really well with just a couple treatments. Case in point, Ben Greenfield, when he wrote that hilarious essay about his GainsWave experience, he's a healthy guy, and he got an instant and robust response. So that's what I would encourage people to try to emphasize, that foundation, that daily habit, whatever you can do, just accumulate that health step by step. And you'll be better off when something goes wrong and you need some higher force intervention.
You mentioned the biggest vertical you have is sexual wellness. I know you're doing GainsWave, you're doing PRP injections. Have you been doing anything with the stem cell therapy for sexual wellness, or exosomes for sexual wellness? Have you seen that as something that's...
I do use those, but I don't use those for sexual wellness. I use those for joints, mostly osteoarthritis of the knees, hips, and shoulders. We do adipose derived, not supposed to call it stem cell anymore.
What's the term of the month? It's cellular tissue.
Orthobiologics is what everyone's calling it, because it's really a mix of, you got stem cell rich tissue with mesenchymal stem cells from adipose or bone marrow. So those are what I endorse. We do a little bit here. I refer out to docs that do it, but mostly for orthopedic complaints. When you lay down that foundation of nutrient and hormone repletion, and make sure the blood sugar is stable, make sure they're not smoking, just doing focused shockwave and PRP, P shots, my results are 90+%. So I haven't found a need to do those much more expensive treatments for patients to get good results. I worry about doing any sort of like tissue derived stem cell rich concentrate like bone marrow or adipose. I wouldn't want to inject that into the corpus cavernosa, because there's going to be some cellular debris in there that may kind of block up the spongy layer of the penis. So then you're left with more what I call stem cell in a bottle stuff. So tissue, placental tissue matrix, like amnion products. And those ones they're pretty potent. I have seen some patients get good results with those from other practitioners. But I know I don't use those so much in lieu of a P shot. With my M-Site system, I can concentrate that PRP down to 12 or 24x. So, you know, compared to a gel tube, which gets you 1.5 to 2x concentration, it's much, much more concentrated. So the way that shockwave and PRP works together is shockwave induces a shear stress on the cells that elicits this huge storm of growth factors and cytokines that attracts stem cells to the area. This is a phenomenon called chemotaxis. And through chemotaxis, these stem cells are attracted to this tissue that the body thinks has been damaged somewhat by the shockwave. It's kind of a pseudo trauma. And then we see this 9-fold increase in stem cell concentration in the tissue. Then you can imagine when you do shockwave in conjunction with a P-shot, where we're amplifying those growth factors by 12 to 24 times, we see a huge influx of stem cells into the region. This has been proven with immunofluorescent staining, where they stain the stem cells, and they can see them migrate into the tissue. The reason I prefer that is these stem cells are going to be in the appropriate environment to signal them to do their thing, to change into the kind of tissue you want them to change into. When we're collecting stem cells from another environment and just injecting that blindly into tissue, we don't really know what those stem cells are going to be triggered to do their thing, to do what stem cells are supposed to do, rejuvenate and repair tissue. So I like to kind of trust the body's natural process, again, because I'm a naturopathic doctor.
I was going to say that it's trust the body. And I think in traditional healthcare, it's like, if you trust the body to do things, you can't charge those insurance-based high medicine fees, but the body's always been the stuff that heals you.
And again, it's just about removing obstacles, right? What's keeping that person from regenerating that tissue? Is it nutrient depletion? Is it hormone status? Have they had a life of oxidative damage from smoking, from their hazardous work environment, from just our normal modern life is an oxidative nightmare. And so the minimal intervention possible to get the results we want is always what I'm looking for. And I worry that when we add in, more complicated procedures, we're doing tissue grafts, stem cell rich, amnion in a bottle, introducing risk for, infection, fat necrosis in the case of stem cell grafts. So those complications are admittedly very rare, but I'm currently asked to be an expert witness for a provider who used a little amnion bottle and injected into a patient, and unfortunately had bacteria in it, and that patient got a pretty bad septic arthritis, right? So I know when I prep my own PRP, that stuff is 100% sterile. I do it in a laminar flow hood. It's a closed system anyway with the M-Site system, so it's never exposed to the air. And so I worry about something that I didn't do myself. I'm a little bit of a control freak when it comes to procedures that I'm doing on my patient. And so I hesitate to use some of those newer exosomes and amnion products, though I've seen them do miracles too. I think that's a growing field that needs a little bit more research and study. I've used amnion on a busted up ankle of mine, and it hurts so bad. I felt like my ankle had been pepper sprayed from the inside out. But 3 weeks later, I was walking on it pain-free, and I haven't had any trouble with my ankle for like 2 years. So
have you used the shockwave also for orthopedics? Oh
yeah, of course. That's what shockwave initially was intended to be, as an orthopedic device. So I use my Storz D-Actor 100. That's the radial shockwave I use. I use that for I call it my magic wand. I use it for plantar fasciosis. I use it for rotator cuff tendinosis, bone spurs, you name it. Anything that you can get within that first 1.5 centimeters of tissue, because that's about how deep those radial frequencies go. It's my little magic wand. And oftentimes I'm a treating guy with, for ED. And I've got I have a bunch of devices. I've got my Duo, which is a focused shockwave. I got my radial, which is the more hard hitting, but it doesn't penetrate as deep. And I'll mix it up guy will be like, hey, can you tune up my shoulder right after I got done treating his ED? I'm like, sure. So I just, do a little 6-minute treatment on a rotator cuff, and it's amazing how quickly they get better. I'm surprised those aren't used more like in physical therapy settings and orthopedic offices.
Yeah, no, you're right. Like I sprained my psoas, my my hip flexor. And I went to a chiropractor and I asked, why don't we just put some shockwave there? And it's like, well, we don't have a shockwave. I'm like, you're a chiropractor, you don't have a shockwave device?
Yeah, not very many of them do. It's an incredibly effective device. My mother-in-law's sister was struggling with plantar fasciosis for like 6 years, and she'd become sedentary to the point where her health was at risk. I just Googled and found a provider in California that had a shockwave device and sent her there. Within 6 visits, her plantar fasciosis was gone.
So, you get these guys, they always come in for the erections or the brain function, but then when you get them and you do your lab testing and you talk to them about diet, I think a lot of this is just education. But how many of these guys that are coming in there, do you go over diet and you've changed? Do you do anything with peptides and
yeah? I always talk about diet with my patients before I treat anybody for ED. They have to go through the SageMed basics. So as I mentioned, nutrient hormone repletion, and then we really get into diet and exercise, because I don't want a bunch of guys out there saying, oh, I went to Sage and I got shockwave and it didn't work. I don't want people saying that. So I don't treat them until they're ready. And I let them know right at the consult that I do, like, okay, it's going to be 3 months before we even put shockwave on your body. We're going to get things laid down with a solid foundation. And so the diet I recommend most is a plant-based diet, low in processed foods, none preferably. I do recommend very minimal or no alcohol. I recommend avoiding most grains. And so the emphasis really is on vegetables, fruits, and whole meats, not processed meats. And so it's kind of a Whole30 style diet. And if I can get them to do that 5 days on and have a couple of cheat meals on the weekends, most guys, their health will improve dramatically. And a lot of guys just simply don't exercise. I ask people about exercise and like, I walk the dog 2 miles every day. That's not exercise. I mean, that's movement, and it's better than nothing. But you got to get sweaty. You got to lift some weights. You've got to do some cardio. And the concept of exercise and hard work for a lot of people, it's been a long time since they really pushed themselves. It's uncomfortable, and they can't really get into a good groove. So that's honestly the toughest thing, is to get guys on a good exercise habit.
You're right. People are always looking for a magic bullet. I read something though about is it tizapatide, or it's tirzepatide, which is like
it's a GLP-1 agonist.
GLP-1 agonist. They said that's a peptide, right?
Yeah, that's the same with semaglutide.
Semaglutide too.
Yeah. So they're these GLP-1 agonists have been really helpful for my patients. I am one of the first docs to start using those, what's lucky for me, because
that's hot.
It's really hot now. The pharmacy I use, they don't let people who haven't been prescribing it for the last couple of years start new accounts, because they're just having a hard time keeping up. It's so hot right now. But those peptides those are not without risk. They're right up there in potency with medicines like insulin. So and they're working on those same pathways. So with those medicines, and I'm not an expert in diabetes and these kinds of medications, but specific to weight loss, the appetite suppression you get with these are unreal. The appetite suppression is I mean, sometimes people can't even look at food, they get nauseated. They're very, very powerful meds. For people with severe recalcitrant obesity, where they just, you can tell they've honestly tried everything and they've given up. I do prescribe it, but it's not a first-line therapy for me because the constipation, the nausea, the headaches, they're significant, and I think a lot of people need to be aware of that before they start these meds. But for people who are really stuck, they're very powerful tools. I've seen it change some lives. In particular, binge eating disorder and things like that. It's been very effective. So very exciting. And, we do have some good research. I think one of them, the Wegovy form of semaglutide, is now FDA approved for weight loss.
That's the Eli Lilly drug, correct? Or is it not Eli Lilly? Is it Merck or Eli Lilly?
Who makes Wegovy? I don't remember the pharma that makes that, but I'm sure they're enjoying themselves immensely right now. Yeah. The trend that picked up on social media with those meds really went viral. I do try to respect the fact that people need these medicines for their diabetes. So I do want my patients come in like, hey, I want to try this. I'm like, okay, but let's try a couple things first, to try to find some alternatives, some less intense measures to get the results they want. But if someone's honestly like tracking their calories, they're exercising regularly, they're just really stuck, I will prescribe that for them.
When I look at like your practice, you hit the 3 Bs. I always say, like, if you could hit the 3 Bs of what every guy wants, which is brain, body, and bedroom performance.
Yeah.
you give the guys those 3 things, we're gonna die happy. You give me a brain function, body, I'm done.
Yeah.
I want to congratulate you. I've known you now for 6 years. You have an amazing practice. Do you do any telehealth? If anybody's listening to this and they want to get in touch with you, or do they have to come out to Washington State?
Oh no, yeah. With telehealth, we've been set up to do that for about 5 years. So fortunately, we were already doing that before the pandemic. So our transition to predominantly telehealth during especially those 2 years of intense shutdowns, that's what saved my business. In Washington, we have very strict closures and social distancing laws, because we were ground zero. This is where COVID started, and well, in America, I should say.
Yeah, I was gonna say, move on.
But yes, for telehealth, it's complicated. It depends on what state they're in and what their telehealth rules are. During COVID, they relaxed telehealth rules. I could consult and prescribe and diagnose across state lines as long as I was here in Washington where I'm licensed. Mm-hmm. And now they've rescinded those rules. Right. And so I can, if someone just needs education, they need to bounce a case off of me, I can do case reviews and I can make recommendations and referrals. But I can't diagnose and prescribe because, 1, it's not really optimal to do that by video. And 2, they need a local physician to manage their meds. But a lot of people that I do telemed with, they just need me to do a case review. So I'll review their case. I'll say, look, this is your obvious, pitfalls. Here's a list of tests I suggest you get done. Here's some suggestions for to talk about with your physician. And I will try to find them a local physician that will work with me to get them those prescriptions and treatments they need. So absolutely, yeah, give us a call and we can do a video chat and I can help you.
You work more like a coach, you help them. That's amazing. So best way to get in touch with you, we're gonna have links in the show notes, is sagemed.co.
Yes. Yeah, you can schedule directly on our website.
Okay, no, I appreciate the time. It's always great to talk to you, Dr. Wheeler.
My pleasure, Mark. Thanks for having me.
Yeah, congratulations on a successful practice, because you've always been cutting edge. You were the first in Washington State to do GainsWave. I see what you're doing with the semaglutide and all the other stuff. So if you want the latest, just reach out to Dr. Wheeler. Thank you so much for your time.